Welcome back to the Living Diabetes podcast. I am your host, and today we are tackling a topic that has generated a lot of questions and concern, especially as GLP-1 medications have become so widely used. We are talking about GLP-1 medications and mood changes. Can drugs like semaglutide, tirzepatide, and liraglutide affect how you feel emotionally? Let us look at what the evidence actually says. First, some context. GLP-1 receptor agonists are now among the most prescribed medications in the world. Millions of people are taking Ozempic, Wegovy, Mounjaro, and related drugs for diabetes and weight management. With that scale of use, reports of mood-related side effects were inevitable, and they have indeed emerged. Patients have reported anxiety, depression, mood swings, irritability, and in rare cases, suicidal thoughts. Regulatory agencies, including the FDA and EMA, have been investigating these reports. So, what does the science tell us? GLP-1 receptors are not just in your gut and pancreas. They are also present in the brain, specifically in areas involved in appetite regulation, reward processing, and emotional regulation. The hypothalamus, the amygdala, and the hippocampus all express GLP-1 receptors. This means these medications do have the biological machinery to affect mood and cognition. The question is whether they actually do so in a clinically meaningful way. The clinical trial data presents a mixed picture. In the large phase 3 trials for semaglutide and tirzepatide, depression and anxiety were reported as adverse events, but at rates that were generally similar between the drug and placebo groups. This suggests that for the majority of people, these medications do not directly cause mood disorders. However, clinical trials have limitations. They often exclude people with pre-existing mental health conditions, and the follow-up periods may not be long enough to capture delayed effects. Post-marketing surveillance and real-world studies have been more nuanced. Some observational studies have actually found that GLP-1 medications may have protective effects on mood, possibly related to weight loss itself, improving quality of life and self-esteem. Other reports have identified a small subset of patients who experience new-onset mood disturbances after starting these medications. Disentangling cause and effect is difficult because the conditions these drugs treat, diabetes and obesity, are themselves associated with higher rates of depression and anxiety. There are several mechanisms through which GLP-1 medications could potentially affect mood. The first is direct central nervous system effects. Since GLP-1 receptors are present in brain regions involved in emotional processing, the medication could theoretically alter neurotransmitter signaling. Animal studies have shown both antidepressant and anxiolytic effects of GLP-1 receptor activation, which is actually encouraging. The second mechanism is indirect. Rapid changes in body weight, altered eating patterns, and the loss of food as a coping mechanism can all have psychological consequences. For some people, the dramatic reduction in appetite caused by these medications removes a source of comfort and pleasure, which can contribute to feelings of emptiness or low mood. This is not a pharmacological side effect per se, but rather a psychological adjustment to a fundamentally changed relationship with food. The third consideration is blood sugar changes. Particularly in the early weeks of treatment, blood sugar may fluctuate more than usual as the medication takes effect. Hypoglycemia can cause anxiety, irritability, and confusion. These symptoms can be mistaken for a mood disorder when they are actually a glycemic issue. So what should you do with this information? First, if you are starting a GLP-1 medication, be aware that mood changes are possible and pay attention to how you feel in the weeks and months after starting. Second, if you notice new or worsening anxiety, depression, or mood instability, do not dismiss it and do not assume it is just stress. Tell your doctor. They need to know so they can determine whether the medication might be contributing. Third, if you have a pre-existing mental health condition, this does not mean you cannot take a GLP-1 medication. It means that closer monitoring is appropriate and your mental health treatment may need adjustment alongside the new medication. Communication between your prescribers is important. Fourth, do not stop your medication abruptly without medical guidance. If a dose adjustment or switch to a different medication is needed, your doctor can manage that transition safely. The bottom line is that GLP-1 medications are effective and well tolerated for the vast majority of people. The evidence for widespread mood-related harm is not strong. But individual responses vary, and a small number of people may experience mood changes that warrant attention. Being informed and communicating with your healthcare team is the best approach. Follow us on social media for daily updates and more content. Until next time, take care of yourselves.